So now I'm going to tell you about my story. In third grade, my mother walked me into a developmental optometrist office and said, "He's my oldest child, and he's the worst reader. Tell me why." And the truth was, I couldn't see. When I go to sleep, my eyes rest at about here. They don't line up. And when I want to look across the room, I can get them to line up. But when it comes time to turn them all the way to here, I just couldn't do it. So I was given a special pair of glasses. This is similar to convergence insufficiency like we talked about before, with some prism in them. So that instead of having to turn all the way to here, I only had to get to here. Now, over time, most of these disorders with most children get better on their own, even if we did nothing. And mine was the same way. By about puberty, mine was pretty much gone. And at that point, I went into contacts. You can't put prism in contacts. It just doesn't work. And so around the age of 16, I was in contacts. I was in no prism because we'd slowly pulled the prism out, and I had the fine motor control on my own to deal with this. Around the age of 28, I looked at my partner after having graduated optometry school and said, "You have to give me an eye exam because I'm getting raging headaches." And the reason that I was getting headaches is because my fine motor control had broken down so much that I'm back in prism. My ability to keep my eyes lined up on my own had worn off. I could go back in and do vision therapy again if I wanted to, but frankly, I kind of like my glasses, and I'm not interested in doing therapy, and truthfully, I think I have a big nose, and I'd like to cover up for that. So, I wear my glasses all the time, I've added prism in them, and I don't get headaches now. So, these things happen. Now, most people won't wear out like I did. It's just I'm such an extreme case that I wore out at 28. Oftentimes it happens later on in life to people when they're more mild. And actually this is one of those things that's often undiagnosed in the elderly population. They dealt with it as a kid, they're embarrassed to talk about it now, and so nobody really treats it. But it's pretty easy. All I had to do was add prism to my own glasses, and now I don't get headaches.